Community analysis. This analysis is on Lealman. It will be covering the history of Lealman, the evolution as of today, the community structure, population concerns, health concerns, resources, community objectives, the environment, the government, community needs pertaining to health related, and the community versus global on the crime rate affecting the economy. Lealman started off in 1862 as a small rural community. It was connected by Joe's Creek dirt roads and railroad tracks. The community was named after Eliza Lealman. Eliza was the sheriff for approximately 4 years and the tax collector for Suwannee County for approximately 6 years. In 1895, Lealman was first noted on the Hillsborough County map. The population was so small that the history of this community is very hard to locate. But basically, trains would come in and drop off supplies like citrus, eggs, resin from nearby turpentine stills. And then they would pick up outgoing train cars or passengers. This community was so small, the passengers would actually have to purchase their tickets through the conductor because there was no ticket counter. However, this community is still striving today to move on to the future. They have been approved for the Community Redevelopment Act of 1969, and their plan is to build new playgrounds, a grocery store, to fix some sidewalks and drains. Some of this has been done, and some markers for the community have been placed, but it is still a work in progress. Lealman is a large unincorporated area. This community sits on 3 square miles or 2,525 acres. There are 4 zip codes in this community and is considered to be St. Petersburg when mailing anything. There are a total of 10,704 units on Lealman, and 1,828 are vacant, and 3,922 are rented. There are houses, trailers, and apartments. Approximately 60 to 70% are in need of landscaping and remodeling. Lealman is currently in the redevelopment process. There are approximately 19,877 residents in Lealman, with a population density of 4,962 and only 230 tourists. 57.5 of this population is between the ages of 18 and 64 years old. The majority of the race is white at 78.6%, which only 52.7 are employed. The middle income is approximately $31,000 a year. 26% of the community is in poverty. There is 22% that have a 12th grade and below level of education. This urban area is lacking a grocery store. There are a lot of fast food restaurants, liquor stores, and convenience stores, which qualify this community as a low access community. Lealman's community structure needs to be redeveloped. I stopped by and spoke to some residents, and they compared their community with the outside communities. They don't understand why their roads are all tore up and why their roads flood and why their draining systems don't work. They don't understand why they don't have grocery stores, fresh fruit markets, department stores. They don't understand why there's so many convenience stores, why there's lots of liquor stores, lots of fast food restaurants. They believe that if they bring more jobs to the area through redevelopment, then poverty levels would decrease and crime rates would decrease, and that their community would become safer and they would be able to stand on their own 2 feet. Pinellas County Planning Department is working hard with Lealman community to redevelop them. Based off the United States Census Bureau, Lealman's population is varied with more Asians at a 6.9% than Florida at a 2.4%. White alone in Lealman is 72.9%, and Florida is at a 57.9%. There also seems to be less percentage of African Americans in Lealman at an 8.5% than Florida at a 16%. And Hispanics in Lealman are at a 9.5% than Florida at a 22.5%. Based on a community assessment, I found that Lealman or Pinellas County is not the healthiest community on my comparison to Florida. The following stats are per 100,000. Heart disease is 111 in Pinellas County and only 102.5 in Florida. Adult diabetes are at 12.4 for Pinellas, while Florida is at a 10.4. This could be due to adults that are overweight are a 41.6 in Pinellas, whereas in Florida it's at a 27.2. Lung cancer is at a 67.8, while Florida is at a 63.4. This could be due to smoking within the community. Pinellas smokers are at a 19.3, while Florida smokers are at a 17.1. HIV is 4.5 in Pinellas, while Florida is a 4.7. Chlamydia is at a 428.6 in Pinellas, while Florida is a 409.8. Gonorrhea is 126.5 in Pinellas, while Florida is at 105.3. And syphilis is at a 6.5 in Pinellas, while Florida is at a 7.3. There are no noticeable patterns for sexual diseases between Pinellas and Florida. However, there is an increase in multiple births within Pinellas, rates at a 3.6, and Florida rates are at a 3.3. Lealman is an unincorporated community which has resources that are administered by Pinellas County. The resources such as health care, burial, dental, water, electric, and cable are very accessible. These services are acceptable and affordable and can be found on the Pinellas County website. Some of the health care, dental, and burial resources can be delayed by paperwork but are rather quite efficient. However, transportation can be an issue for Lealman. The buses do not cover the whole area and can cost an individual up to $120 a month. Taxi cabs are expensive and charge per a mile. Residents have to go outside their community to go to grocery stores and department stores. With only convenience stores in the community and fast food restaurants, it can be quite expensive, and individuals will pay approximately 1.3% more a year. Focus objectives for this community are heart disease, nutrition, including weight status, and tobacco use. All these objectives are higher in Pinellas County than in Florida. All these objectives have been discussed by Healthy People 2020. Heart disease is the leading cause of death for this country. Through prevention, detection, and treatment, it will decrease the risk of stroke. This will reduce death and health care expenses. Nutrition and weight status is insufficient. Healthy diets and weight decrease will decrease chronic disease. It will establish proper growth and health, which will decrease chronic disease and expenditures. This is accomplished through food security, education, and monitoring unhealthy habits. Reducing tobacco use will reduce illness, disease, disability, and death rates for this community. Not smoking will decrease disease and death. This can be addressed through education, tobacco cessation support, and encouraging tobacco users not to smoke. Driving around Lealman, it seems very peaceful. The parents are sitting on the porches, watching the children play. Neighbors are over visiting. Communicating with a few of the parents made me realize that they don't think their children are safe because the crime rates are so high. As I continued to drive around Lealman, I noticed a lot of people hanging out and loitering. I noticed there were a lot of dead ends, a lot of potholes, and a lot of patches in the roads. There isn't much room for sidewalks because the ditches are right on the side of the road. They're open, they have trash and debris in them. I also noticed a lot of old homes and businesses that needed to be cleaned up. The government of Lealman is unincorporated, which means it is run by a community association which is overseen by Pinellas County. The community association is lacking due to their poor contact information, outdated websites, and their meetings at the VFW. Attempting to drive to the VFW for a meeting, and I was unable to because of road construction. Pinellas County, on the other hand, has placed out 2 feasible studies of Lealman, one in 2002 and one in 2015. Both of these studies state that Lealman need to be redeveloped and how they're going to do it. However, their plan is to take 40 years. My concern here is for a quicker redevelopment of Lealman. With more involvement from the community association, Pinellas County, and the residents, Lealman should be redeveloped pretty quick. This will decrease crime rates and the poverty level and increase jobs to the area. Lealman has plenty of health related community needs. They are the government structure, safety, education, immunization, nutrition, and environment. The government structure needs to be revised so the other community needs can be met. Safety needs to be addressed because the crime rate's high and the sidewalks need repair. Education is important because knowledge is power and increasing involvement within the community. Addressing immunizations will decrease the health risk within the community. With the proper nutrition, it will decrease disease and healthier residents. And when we address the environment, it'll keep us from attracting unsafe behaviors. With all these needs addressed, the community will have a better outcome on health. They will live longer and they will function better. Crime is an issue for the Lealman community and the global community of Trinidad, which takes a toll on the economy. Trinidad noticed that crime rate levels have increased. Residents have taken actions with fenced-in yards, placing burglary-proof doors and windows with security cameras, and getting loud dogs. Officials notice a decline in tourists and an increase in poverty. Their action is requesting residents not to go on vacation, to speak out and report suspicion. Officials are working with the police and residents to decrease crime and preserve their economy. Lealman's community has a Crime Stoppers program in place with Pinellas County. The budget has increased for the police. Pinellas County is in the progress of redeveloping Lealman to increase their economy. Other countries such as Brazil are having similar issues with crime increasing and the economy decreasing. Community health nurses should be educating the community on preparing a plan for their family, building a safer environment, to speak up with suspicious behaviors, and how to protect their homes, family, and environment. Does anybody have any questions?